Hey, you guys, welcome back for another week of Work It Out Wednesday. You know, on Wednesdays, we work out a practice question to test your knowledge on the topics that we have covered for the week. So, this week, we've been talking about SSRIs and MAOIs. And if you haven't had a moment, go back and check out the video from yesterday on our Topics and Tips Tuesday, where I went through those SSRIs and MAOIs, going over the drug classes, the drug endings, the mechanism of action, the contraindications, and it's just a quick overview so that you can tie these things together. So as we talk about treatments and we talk about different diagnoses, that you know how to quickly identify those drug classes and those medications and which ones we commonly prescribe. But let's get into these questions for the week, okay? Question number one states, a 39-year-old female presents to the office today with complaints of feeling depressed. She states that she has had difficulty for some time now, but most recently noticed the inability to get back to herself. She states that she has no interest to do the things that she loves and is often tearful. Her thyroid panel is normal. Which drug class is commonly prescribed for major depressive disorder? Is it A, MAOIs, B, TCAs, C, SSRIs, or D, PPIs? And I'll give you a moment to work through this practice question. Put your answer choice in the comment. Let's see how you do. All right, as always, I tell you guys to read the stem of the question first so that you can ensure that you're answering what they're even asking you, right? Because you know how we do. We can start to formulate our own little storyline and create something, and they didn't even ask us that. So the stem of the question states, which drug class is commonly prescribed for major depressive disorder? So remembering that MAOIs, TCAs, SSRIs are antidepressants, right? But make sure you're not leaving out little keywords. Keywords can change, well, not even just can, will change a question at any moment. So it says commonly. So I want you to remember that SSRIs are the most commonly prescribed antidepressant. So your best answer choice here is C. You know PPIs have nothing to do with this. All right, next question. Question number two states, a 72-year-old female returns to the office for follow-up. She has a history of hypertension, anxiety, depression, and anemia. She states that she needs to be restarted on an antidepressant as she has not taken one in years, but knows that she needs it. Based on the provided information, which medication should the nurse practitioner consider prescribing? Is it A, Prozac, B, Zoloft, C, Paxil, or D, lithium? All right, you guys, I'll give you a moment. Be sure to put your answer in the comment section so I can see how you're doing. All right, let's read that stem of the question. So the stem of the question states, based on the provided information, which medication should the nurse practitioner consider prescribing? So, okay, this lady has a history of anxiety. She has a history of depression. She states that she's taken the medication in the past. So then we start to think of, all right, what are good medications? What are antidepressants good for depression and generalized anxiety? What are things that we can utilize to treat? She says she was on one previously, hasn't taken it in years. Of course, when you're doing your assessment, ask the patient what they took previously, what worked for them. But as we're starting from a clean slate and you're going to start doing considerations for prescribing, and notice here that question says the nurse practitioner should consider. So when you're starting to consider prescribing something for her, would you do Prozac, Zoloft, Paxil, lithium? Lithium is one of those medications that are good for the management of bipolar disorder. So with the choices we have here, I wouldn't say that's the best one. And then when you're looking at Prozac, Zoloft, Paxil, you're thinking, those are in that SSRI drug class, basically the same thing. But I want you to think, and this is where things can come along. Go back to the video from yesterday, because one thing that you should pay attention to here is this lady is 72 years old. This is an elderly lady. So one, you can quickly eliminate A. Prozac, you don't want to use Prozac with the elderly population. Talked about that on yesterday as well. So eliminate A and D, right? So Zoloft and Paxil. Now, there's nothing wrong with Paxil, but Zoloft is known to be one of those friendly meds that work better with the elderly population. So the best answer choice here is B, Zoloft. Also remembering citalopram is also a good one for the elderly population as well. All right, last question for this week. It states the nurse practitioner started her patient on an MAOI today. What education shows the nurse practitioner's understanding? Is it A, avoid foods high in tyramine, allow 2 to 3 weeks for effectiveness? B, avoid carbohydrates? C, avoid things high in cholesterol and allow 2 to 3 weeks for effectiveness? Or D, avoid sodium? All right, tell me what you got in the comments, and I'll give you a second to think on it. All right, you guys. So STEM is basically asking what education shows that the nurse practitioner has understanding of something you should be providing for somebody who's on an MAOI, right? So A, avoid foods high in tyramine and allow 2 to 3 weeks for effectiveness. Okay. B, avoid carbohydrates. Not so much. We can eliminate that. C, avoid things high in cholesterol. Allow 2 to 3 weeks for effectiveness. Cholesterol is not so much associated with MAOIs. And D, avoid sodium. We could take that out. A is the better answer. We know that you want to avoid things high in tyramine, right? With our MAOIs. Remember, I was telling you about my undergrad farm teacher, and she used to sing this song, MAOI. I can't have my pizza pie. Why? Because remembering things that come on a pizza, right? Those aged cheeses, the aged meats like your pepperoni, and things of that nature. But remembering foods high in tyramine with MAOIs can cause patients to go into a hypertensive crisis. So you want to be sure that you are telling them that. So those aged cheeses, again, those aged meats, um, alcohol, a lot of those citrus fruits are high in tyramine. So making sure you're educating your patient on this, and also educating them on the fact that you need to allow 2 to 3 weeks for effectiveness. Once you have started this medication, that's when they'll start to notice it. But also remember, like I told you guys on yesterday, that they need to really take this medicine for about 6 months for the most benefit from it. All right, you guys. As always, thank you, thank you, thank you for joining me. I hope you found this helpful. And be sure to like, comment, subscribe, and share with a friend, colleague, or whomever you may think that will find this helpful. And be sure to meet me back here next week for Work It Out Wednesday. Also, be on the lookout this week because I'm going to do some soap notes. Is something I'm adding in this month. Soap notes, so that you can kind of learn and walk through how to do those based on the things that we're covering for the week. All right. All right. Tell me your thoughts on that. Bye, y'all.